Come in.
Good morning, sir.
Morning.
I'm Cyril. I will be your nurse for today. So, sir, can I have your armband, please? Okay. Can you state your name for me, sir?
Earl.
How about your age?
24.
Okay, sir. Earl, thank you. So, for today, sir, I'm gonna be removing and inserting your bed fan. Will that be okay with you, sir?
It's okay.
Yes, sir. So now I've already introduced myself to the client. I've already identified his name and explained him the procedure. Now let's move on to the next step.
Wear disposable glove.
So assuming that I have already performed medical hand washing and hand hygiene, I'm gonna wear my gloves. So sir, I'm just wearing my gloves, okay?
If the bedpan is metal, warm it by rinsing it with warm water.
Okay. So assuming that this metal assuming that this bed fan is metal, I'm gonna warm it by rinsing it with warm water. Okay.
Adjust the bed to appropriate height.
So sir, I'm just gonna adjust the bed to an appropriate height so that you'll be laying comfortable on the bed, okay?
Okay.
Elevate the side rail on the opposite side.
So sir, I'm just gonna elevate the side rails on the opposite side, okay? Okay.
Ask the client to assist by flexing the knees, resting the weight on the back heels, and raising the buttocks, or by using a trapeze bar if present.
Okay, so first I have to remove the blanket and top sheet to proceed with the sleep procedure, okay? So I'm just gonna expose your area, okay? So I'm just gonna prepare these bedpan. So sir, I'm gonna flex your knees, okay? Yes, sir. And
Ask, I mean, help lift the client as needed by placing one hand under the lower back, resting your elbow on the mattress, and using your forearm as a lever.
okay. So I'm just gonna put this bedpan over here. And I'm gonna use this waterproof barrier. Yes, sir. So sir, I'm gonna lift your lower back, okay?
Okay.
So that I can put this waterproof barrier, okay? Yes, sir. Okay.
Lubricate the back of bedpan with a small amount of hand lotion or liquid soap.
So I'm just gonna lubricate this bed fan using a small amount of a liquid soap. Okay.
Place a regular bedpan so that the clients rest on the smooth, rounded rim. Place a sleeper pan with a flat, low, and under the client's buttock.
Okay. So sir, I'm just gonna insert this bed fan under your buttocks, okay? So sir, okay. Count of 1 to 3. Okay, thank you. So, okay.
For the client who cannot assist, obtain the assistance of another nurse or place the clients on his or her side. Place the bedpan against the buttocks and roll the clients onto the bedpan.
Okay. So sir, I'm just gonna remove this. So sir, I'm gonna have you to repeat the procedure, okay sir? So sir, I'm gonna flex your knees, okay? So sir, can you move on the other side of the bed? Okay. So, so I'm just gonna put this bed fan against your body, okay? So sir, roll over here towards me. Okay. So I'm just gonna lay your foot flat. Okay.
Elevate the client's bed to a semi-Fowler's position. If permitted, if elevation is contraindicated, support the client back with the pillow as needed.
Okay. So, sir, do you want me to put your bed into a semi-forward position, or are you comfortable with your position right now?
Yes, yes, yes.
Okay, so you are comfortable, sir. Okay.
Provide toilet tissue. Place the cold light within reach. Lower the bed to the low position and elevate the side rail if indicated and leave the client alone.
Okay. So, sir, I'm just gonna put this toilet tissue in your bed, sir, if you need this, okay? And I'm just gonna put this call light within your reach so that you can call me whenever you're finished, okay?
Okay.
And I'm just gonna lower your bed to the low position and brace both sides. Okay. Okay.
Cover the client with bed linen.
So as you can see, I've already covered the client with the bed linen to hide his exposed area.
Answer the call bell promptly.
Okay. So sir, call me when you are finished, okay? So I will leave you for a few minutes, okay? Yes, sir.
Do not leave anyone on a bedpan longer than 15 minutes unless they are able to remove the pan themselves.
So always remember to do not leave anyone on a bedpan longer than 15 minutes unless they can remove the bedpan by themselves.
When removing the bedpan, return the bed to the position used when giving the bedpan. Hold the bedpan steady. Cover the bedpan and place it on the adjacent chair.
Okay. So sir, I'm just gonna remove this blanket, okay, and expose your cranial area. So I'm just gonna adjust your bed to the original position as I've given you your bedpan earlier, okay? So I'm just gonna get this garbage bag and prepare it. So sir, I'm gonna flex your knees, okay? The other one, sir. So sir, can you lift your buttocks for me, okay? Yes, sir, thank you. So always remember to keep the bedpan steady and hold it still. Then open the garbage bag. And put this in the garbage bag. And put this in the chair adjustment.
If the client needs assistance, don't glove. Don't glove and wipe the patient's perineal area with several layers of toilet tissue. If a specimen proof is needed, place the tissue in a receptacle other than the bedpan.
Okay, so sir, I need you to move to the other side of the bed, okay? So, to proceed with the procedure, I'm gonna wear gloves. Okay. Now I'm gonna use this toilet tissue paper. So, proceed with the procedure. I'm gonna use this tissue paper to wipe the client's perineal area from front to back and wipe it until it's clean. Okay, and dispose.
Wash the perineal area of dependent patient with soap and water and thoroughly dry the area.
Okay, so I'm just gonna use this washcloth, warm water, and this liquid soap. So assuming that this is a washcloth, so wipe from front to back, warm water, and thoroughly dry the perineal area. Okay.
For all patients, offer warm water soap, a washcloth, and a towel.
Okay, so sir, you can lay on your back now. Washcloth, tissue paper, and liquid soap. So I'm just gonna wet this washcloth and some liquid soap, and then clean the client's fingers individually. Okay? Just remember to clean it nicely. Sir. Okay, thank you.
Assist the patient to a comfortable position, empty and clean the bedpan and return it to the bedside.
Okay, sir. So are you in a comfortable position, sir? Okay. Now I'm gonna empty the bedpan and place the garbage can on the trash can and dispose. Now I'm gonna clean the bedpan and put it in the adjusted chair.
Remove and discard gloves and wash hands.
So now I'm gonna remove and discard my gloves and wash my hand and perform hand hygiene.
Spray the room with air freshener as needed. Document color, odor amount, and consistency of urine and feces in the condition of the perineal area.
So after spraying the room with air freshener, I'm gonna document the findings for the odor, the color, the amount, and the consistency of the urine and feces, and the condition of the perineal area. Now, we're done. So, sir, thank you for your cooperation. And thank you.